Now, 25 to 4. There's hardly a week goes by where at some point you think everything's quiet on a certain story, and who chips into the debate? Tony Blair. He's back, and this time he's talking about AI. He says Britain must embrace AI, certainly in healthcare, or risk falling behind in what he's calling the biggest shake-up since the Industrial Revolution. Well, he's certainly not wrong about that. The former Prime Minister said concerns about artificial intelligence should be outweighed by the benefits, especially in transforming public services and saving time and saving money. If you put it like that, what's not to like? He also suggested AI could streamline government itself, making it faster, smarter and more responsive. Let's speak with Dr. Charlotte Blease, author of Dr. Bot, Why Doctors Can Fail Us and How AI Could Save Lives. Charlotte, good afternoon to you. Nice to have you with us. Many of us have seen those kind of documentaries where they've sort of done early experiments with what I suppose could now be sort of called AI, as they're able to pinpoint, I don't know, in neurosurgery as an obvious example, part of the brain that your humans simply cannot do, but a machine with adequate learning can do. I mean, you look at that and say, well, what's not to like?
Absolutely, and patients are increasingly turning to these tools as well. So where we previously used Google and talked about Dr. Google, we're increasingly turning to tools like ChatGPT, so tools that are called generative AI, various chatbots that can talk to us, if you like, in real time to answer our queries. Interestingly, sort of regardless of what Tony Blair is saying, and I'm actually in agreement with what he's arguing. I think that AI, we've seen it starting to come for blue collar workers, and the biggest shock maybe is to white collar workers, that when it comes to the professions, including medicine, that these jobs are going to be increasingly disintermediated. In other words, certain tasks are going to be taken over by AI.
Yeah.
I wouldn't want to put a timeline on it, but I certainly think that there's going to be, in the years to come, a lot of flux with the medical profession and other, say, white-collar professions, where aspects of the job may be more efficiently and also more effectively undertaken by AI.
Yeah, I remember speaking to a guy in Silicon Valley maybe 10 or 15 years ago, and he made the not unreasonable point, similar to what you've just said, Charlotte, that when the internet kind of first came out and we began to adopt it, and you could, Google or even Ask Jeeves or whatever you were using back in the day, people said, oh, people will be made redundant, jobs will be, and in fact it had the very opposite effect. It actually created lots of jobs, and that was amazing. He said, and people are now saying this about AI, this is a decade ago, he said, but it won't be the same. In fact, it really won't be a jobs revolution. It will be almost the very opposite.
Yeah, I mean, increasingly economists working in this space are forecasting that the jobs aren't going to come back in the same way. I used to work at Harvard Medical School. I was there for 5 years, and my colleagues were sort of privately in whispers, I was in the medical faculty, said that they wouldn't encourage their own children to enter the medical profession. They would encourage them to do jobs like nurse practitioners. So I think, as I say, there's probably in the decades to come, or almost certainly in the decades to come, going to be a kind of a flux with the professions, but it may be some of these some sort of less high status jobs within the professions, physicians associates, nurse practitioners. So where Tony Blair says that AI is coming for nurses, I'd be less optimistic of that, sort of at least in the medium term, but certainly I think doctors do have more reason to be worried.
Yeah, I was talking to a surgeon not that long ago about this, and he said he's a cancer surgeon and he specialises in a certain area, but he said that just to test the whole kind of AI and the various apps that are out there, he put in a kind of typical set of symptoms that a patient might tell him. My throat's a bit achy, not sleeping that well, my appetite's got blah, blah, blah. But some of it was very specific as well. Certainly I've got a weird pain in the left side of my patella or whatever it was. He said he put it all in there and was sort of both mesmerised and horrified to discover that it came up with exactly the diagnosis he would have given, or certainly the one he would have investigated. Now, that's incredible, right? Because Google doesn't do that. Google will, make you think like, well, God, I better go to hospital.
Yeah.
But this, he said, was, clearly game-changing.
Yeah, I mean, we're all sort of used to using Google and then sort of descending into this sort of cyberchondria where everything seems to lead to cancer. But with these kinds of tools, what's different is they answer back. You can build up a dialogue, and they sort of remember information, so which makes them easier to use as well.
Yeah.
And as you say, there have been various studies, very early studies with, for example, ChatGPT. So I mean, this has only been on the go for about 2 years now, but
Sure.
Using these tools to sort of let them sit medical school examinations. But as you're pointing out, increasingly studies are looking at the very words patients will use. And here, it's harder to dismiss the performance of these tools as just, it's one thing sitting a medical school exam. Mind you, that's what we only expect of doctors. So,
Sure.
but when you actually ask these tools to respond to the vernacular that patients use, some of the wording that they use, they still are incredibly impressive tools. And in many experiments conducted, I should say, by doctors who are seeing what's happening within this space, that they are getting to diagnoses faster, more accurately, including for rare diseases. 1 in 10 people has a rare disease. In Europe, patients wait an average of 8 years for a diagnosis.
Wow.
These tools are able to come up with the diagnostic, correct diagnosis rapidly.
Wow.
So it's
incredible.
really changing things for patients.
Indeed. You just used the term hypochondria. Why have I never heard anybody say that before? That's utterly brilliant.
I can't take credit, it's not my own.
I think you should, Charlotte. Copyright that. You could call the next book that,
perhaps I
maybe.
shouldn't say that, yeah.
But it's so true, because we've all done that with Google. At one point, I thought I had
Yeah.
rabies, for goodness sake. It's very easy to find the wrong diagnosis. But as you say, new AI learning does begin to tell a very different story. And I suppose there's then the practical implication, whereby it's not just about what is wrong with you and how best to treat you, etc., but it's even how you're treated, because machine learning, which goes along with all of this, can also be, and we already, as you know better than me, we already have some of that going on. I mentioned brain surgery, neurosurgery earlier, which is an area where it's incredibly impressive in what it can do compared to even a decade ago. There's going to be more of that, right?
Yeah, actually, I've conducted surveys on this. So, in the UK, so I did a survey 2024 where I asked 1,000 UK GPs across the whole of the UK, are you using tools like ChatGPT for any clinical task? 20% said that they were.
Yeah.
I redid the survey earlier this year. A year later, 25% of GPs said they were using these tools. These are consumer-facing tools that we as patients could be using. So there's something different going on here with these kinds of tools that we haven't seen with other kinds of AI before. And as I say, sort of keep coming back to this, the fact not only are they impressive, but they're easy to use because of that sort of dialogic nature with them. You can have this back and forth with a conversation.
But when you get into, I was just going to say, Charlotte, sorry to interject, but when you get into that area of surgery, I love those kind of surgeons beyond the frontier kind of programs where, you will get the voice, very dramatic voiceover usually, but, they will describe that, this surgeon is literally 0.5 millimetre from a very vital part of the anatomy, and, one wrong move and it's curtains for the patient, etc. But I guess you get to a point where that won't happen, because a machine will be so geared up, so intelligence-led, that it will avoid all of that, in theory.
Yeah, I mean, so some people have, and they've been saying for years, AI, doctors who are AI enthusiasts have been saying, there will come a point where we say, I don't want that surgeon touching me. I want the AI to do it. I want the
Yeah.
robot to do it. Where there may be this kind of flipping over of a sort of cultural shift between what we find acceptable. Because right now, patients do find it acceptable that their doctor, on the whole, find it acceptable that their doctors use AI tools, but they still want the doctor, human doctor, to
Yeah.
be accountable for the decision and make the final decision. But what's really interesting is when you put AI together with doctors, actually it's not a very good team sport. Doctors tend to hurt the accuracy of AI. They don't in other words, they don't use AI as effectively as they could when AI surpasses them.
Yeah.
So there are big challenges there too,
Indeed.
and it
Well, I
may,
mean,
yeah.
confronting the, and I don't mean this as a pejorative, but confronting the ego of a senior consultant is, as I'm sure you know, is not always the easiest conversation in the world. So at least they'll be arguing with a machine.
No, well, exactly, and there's a very serious point there because medicine's incredibly hierarchical, and there's
Yeah.
an awful lot of bullying that goes on in medicine
Yeah.
that again can lead to most errors. Medical errors, the third leading cause of death. So, I mean, there's a very serious case to be made for AI within healthcare. And if you have AI that does not fall foul of some of our worst human peccadillos, that is bullying, getting burnt out, needing sleep, needing to pee, all the things that doctors, in fact, sometimes don't have time to do, or they don't report colleagues who are incompetent.
Yeah.
Half of doctors who have witnessed an incompetent colleague don't report them. Why? They're scared of repercussions. AI doesn't have any of these kinds of challenges that human mediated healthcare does suffer from,
Indeed.
unfortunately. So, but of course, it invites other concerns.
Listen, Charlotte, it's been fabulous to have you on. Thank you for your time. Really appreciate that. Dr. Charlotte Blease, author of Doctor Bot, Why Doctors Can Fail Us and How AI Could Save Lives. That is a fascinating, I mean, it's one, as she rightly said there. I mean, Tony Blair says we got to embrace this stuff. Ordinarily with Tony Blair, you might go, I'll ignore it. But I don't think we're not going to embrace this, are we? If it's about saving your life and machine learning that can do stuff that works, certainly initially in corroboration with physical clinicians and medical teams, no one's going to not adopt that, I would have thought. But it does make, when you start to really overthink it, and it's very easy to overthink it, it's also bloody terrifying. There's a little bit of that. Maybe that's just a human reaction.